Good afternoon, everyone, and welcome to my hometown, Victoria, on the unceded traditional territory of the Lekwungen-speaking people, the Esquimalt and Songhees First Nation. I'm joined by my colleague, the Premier Ministre Quebec, François Legault, the former chair, or the outgoing chair of the Council of the Federation, and he will be here to assist with French language questions and also to speak from his perspective as the former chair to tell the story of how long it has taken us to get to this place where we really have to insist that the federal government step up to the table to sit down with the provinces to address the fundamental issue that we've been wrestling with, both of us, since we were elected to lead our respective provinces, and that is to protect and preserve and enhance our publicly funded healthcare system. Of course, there's a range of other issues that Canadians are grappling with right now. Affordability is the #1 concern around kitchen tables and at workplaces around the country. Whether you be in Prince Edward Island, in Nunavut, or Alberta, the same challenges exist for Canadians, and we are working together as provincial leaders with the federal government to find ways to reduce costs for British Columbians and Canadians as we go forward. And the third primary issue, of course, we want to be discussing together in the next 2 days is the economic recovery coming out of the COVID-19 pandemic. Whatever sector you talk to, the #1 issue for employers is people. They can't find baristas, they can't find welders, they can't find nurse practitioners. Wherever you look at the economy, we're short of people. That means we have to focus on how we're going to build out the national economy, province by province by province, and that, of course, is what we'll be discussing over the next number of days. It is with sadness rather than anger that I stand before you 8 months after getting a commitment from the federal government to work on a pathway to a First Minister's meeting. François and I and my colleagues were promised by the federal government during COVID-19 that once the pandemic was behind us, we would sit down and discuss how we resurrected confidence in the public and confidence from patients and confidence by those who provide public health care in our system. And we're 8 months now past the turning point, in my opinion, for the pandemic, although we still have challenges ahead. But we certainly should be able to sit down and find a way forward with public health care. So that's what we're going to be discussing as colleagues over the next 2 days. And I'll turn the microphone over to François, and then we'll be happy to take any questions you may have.
Oui, bonjour tout le monde. Bien, je veux commencer par remercier John de nous accueillir ici dans la magnifique ville de Victoria. Le remercier aussi pour son travail à la conférence des premiers ministres. Et puis aussi, j'en profite pour lui dire merci de tout ce qu'il a fait pour les gens de la Colombie-Britannique. So I would like to thank you, John, for what you did for British Columbia people, but also for the COF. It was a pleasure working with you during the last year and even before. Donc, on va avoir plusieurs sujets qui vont être discutés aujourd'hui et demain entre les premiers ministres. Bien sûr, le coût de la vie. Les citoyens sont très affectés par les augmentations importantes, l'inflation importante qu'on vit depuis un certain nombre de mois. Donc, on va discuter de ce sujet-là. On va discuter aussi de la relance économique après la pandémie. Et le sujet le plus important, qui est le sujet qui est la demande, la priorité unanime des 13 premiers ministres des provinces et des territoires, c'est le financement de la santé. On répète la même demande depuis maintenant 3 ans. On veut que le financement qui vient du gouvernement fédéral passe de 22 % à 35 %. C'est une augmentation de 28 milliards par année qui est nécessaire, qui est raisonnable quand on regarde les projections des prochaines années. Là, on sait que pendant la pandémie, le gouvernement fédéral a investi des montants importants, mais c'était des montants qui n'étaient pas récurrents. Donc, quand on regarde les projections sur les prochaines années, le gouvernement fédéral va rapidement revenir en surplus, mais les provinces vont additionner des déficits qui vont être de plus en plus importants. Donc, c'est important d'avoir ce 28 milliards récurrent parce que la priorité, c'est évidemment d'embaucher des infirmières, du personnel. Puis ça, on ne peut pas le faire avec l'argent non récurrent qu'on a reçu du gouvernement fédéral. Donc, on va avoir des bonnes discussions, je suis certain. Et encore une fois, très content d'être ici à Victoria.
Okay. Are we turned on here? We're good. We have a very tight timeline for questions, so please identify yourself and your outlet.
Hi there, Premiers. It's David Cochran with CBC News. Intergovernmental Affairs Minister Dominic LeBlanc was just on Power and Politics with Paul Hunter, and he said the 22% number that you, Premiers, say represents the federal share of health spending is a fake number because it discounts historic tax transfers to the provinces that are worth about $20 billion a year. And he also says that your central argument discounts the big spending the federal government did during COVID to take the burden off the provinces, which has allowed some provinces to run surpluses. And Mr. Legault, he directly criticized the $500 check that is being sent to people to deal with the high costs of living, arguing that this is money that could instead be used to deal with health care right now. He says he wants to meet you halfway, but he's also criticizing your central argument. I wonder if I can get a response from both of you to that.
Well, I'd be delighted to meet Mr. LeBlanc anywhere, anytime. Halfway, if that's where he wants to meet, I'm happy to go there. But we're nowhere right now, absolutely nowhere. And it's disingenuous at best to suggest that that the federal government's carrying its load when it comes to funding public health care in Canada. It's just not the case. Now, we can quibble about the numbers, but Canadians will not thank us for that. We can quibble about who's right and who's wrong on the nuance, but Canadians won't thank us for that. What Canadians want us to do is to sit down like adults and figure out how we resurrect publicly funded health care. Patient-centered care is where we need to get to. In order to do that, we need to have a human resource strategy right across the country so that Quebec is not poaching from BC, BC is not poaching from Manitoba. We have a national plan to recruit and retain and train the next generation of healthcare workers, whether they be social workers, nurse practitioners, registered nurses, surgeons, GPs. The whole continuum of care needs to be revisited, and now is the time to do that. We as a council, I've been at the table for 5 years, and the number one issue when I arrived was healthcare. And I'm leaving 5 years later, and the number one issue is healthcare. So if midway is where Mr. LeBlanc wants to meet us, I'm sure François and I would be happy to go there tomorrow.
But, two things. First thing, the amounts we received during the pandemic were non-recurrent amounts. The $500 I sent to Quebecers is non-recurrent. What we're talking about is recurrent amounts. And provinces, we spend about $200 billion a year for health services, and the federal government is giving us about $40 billion, which represent 22%. And in Quebec, Quebecers, they pay 40% of their taxes to the federal government. So it's important that they share more than 22%, because health is the only expenses growing at a rate of 5 to 6% a year because of aging and because of the impact of new technology. So we cannot afford to continue like we're doing right now, the provinces and territories.
Next question, please go ahead.
Bonjour à vous deux, Michel Sabat de la Presse canadienne. Donc, deux questions en une. D'abord, au gouvernement fédéral, on vient d'en parler, on dit vouloir corriger les faits, que dans le fond, Ottawa contribue finalement déjà à bien plus que le 35 % des frais de santé que vous réclamez depuis qu'ils ont cédé des points d'impôt il y a une quarantaine d'années. Donc, un, qu'est-ce que vous en pensez? Puis deux, est-ce que les 5 priorités de M. Duclos, ce sont des conditions?
D'abord, je reviens. Là, moi, je suis un comptable agréé, CPA, et on sait que les dépenses en santé au Canada sont d'à peu près 200 milliards, puis le fédéral nous donne une quarantaine de milliards, donc 22 %. C'est vrai qu'il y a eu un transfert de points d'impôt il y a plusieurs années, mais malgré le transfert de points d'impôt, au Québec, par exemple, 40 % des impôts s'en vont à Ottawa, 60 % à Québec. Puis là, ils payent seulement 22 % des dépenses de santé, alors que c'est un problème partout au Canada. La croissance des dépenses en santé est de 5-6 % par année, donc une croissance plus grande que les revenus. Et donc, ça devient impossible pour les provinces d'y arriver. C'est pour ça que, quand on regarde les projections du Conference Board, bien, les provinces, dans les prochaines années, vont se retrouver à 100, 200 milliards de déficit par année, tandis que le gouvernement fédéral va se retrouver avec des surplus d'une cinquantaine de milliards par année. Donc, c'est clair que le gouvernement fédéral doit augmenter le 22 %, puis malgré les transferts de points d'impôt, il reste que les individus continuent d'envoyer 40 % et plus de leurs impôts à Ottawa. Les conditions, ce qu'on demande, c'est qu'il y ait une augmentation du transfert canadien en santé, donc sans condition, parce que les priorités sont différentes d'une province à l'autre.
Richard Zussman?
Richard Zussman, Global BC. Premier Horgan, one of the things you mentioned in your opening was the cost of living. Can you explain what sort of measures you hope to discuss over the next few days in terms of managing inflation, and how quickly could British Columbians and other Canadians see some of these things implemented?
Well, all jurisdictions are reviewing what capacity they have to help citizens as we struggle with increasing costs, not just for gas prices, but housing costs, rental costs, groceries, and other goods that are going to be increasing in cost as a result of an international phenomenon. And so the advantages of coming together as we have been over the past 2 years through COVID, and as we are here today in Victoria, is to share best practices. The ideas in Quebec are as valid as they are in British Columbia. So sharing what our individual jurisdictions are doing to look at how we can reduce costs for people, how we can protect them from the increases we've seen that are dually responsible, I would suggest to you, coming out of the pandemic and the Putin's aggression in Ukraine. These are seismic issues that are rocking the international economy, and we're not immune to that. But collectively, working together to find best practices, what can we do in our respective jurisdictions, and most importantly, how can we collaborate with the federal government on meeting these challenges? But I say that with the view that, as Francois said, we need sustainable long-term solutions to these problems. And we did very well as a country working with the federal government through COVID-19. We met, I think, 36 times over the course of 2 years, unprecedented in our federation. And we did that because we were drawn together to provide hope to our citizens and opportunities to make sure we were making the right choices at the right time. And we benefited as a country from that, and as subnational governments from that. But now we're on a different page. We're going in a different place, and we need to have a human resource strategy for healthcare. We need to also work to make sure that our private sector entrepreneurs have access to the workers they need to keep their businesses going. And on top of all of that, of course, people at their kitchen tables are saying groceries are out of control. I've got to cut back. I've got to make changes in my lifestyle. And provinces are rightly here to help. And when we find out where the federal government's going on a number of these issues, we can continue to collaborate.
Next question, please.
Bonjour, Nicolas Lachance, Journal de Québec, Journal de Montréal. Monsieur Legault, dans vos priorités à Québec, c'est le rapatriement des pouvoirs en immigration. Ça fait partie de votre plateforme. Comment vous allez convaincre vos collègues des provinces que c'est un enjeu qui est important? Est-ce que vous allez aborder ça en fin de semaine, dans les 2 prochains jours avec eux?
Il faut comprendre que la situation de l'immigration est différente au Québec que dans les autres provinces. La raison pourquoi il y a une entente entre le gouvernement fédéral et le Québec, c'est parce qu'on est une société distincte, qu'on doit protéger le français. Donc, au Québec, le choix des immigrants économiques se fait par le Québec. Et, par contre, il y a une citoyenneté qui est donnée par le gouvernement fédéral. Et là, on a le même problème que les provinces. C'est-à-dire que sélectionner un immigrant économique au Québec, ça prend 6 mois, mais par la suite, avoir l'approbation du gouvernement fédéral, ça prend en moyenne 33 mois. Le 33 mois, il n'y a pas de bon sens pour nous, puis il n'y a pas de bon sens pour les provinces. Est-ce que ça devrait être géré par les provinces? C'est une autre affaire. Maintenant, il y a aussi au Québec 40 % de l'immigration qui n'est pas économique, qui est choisie par Ottawa, où 50 % des personnes choisies ne parlent pas français. Donc ça, c'est un problème qui est unique entre le Québec et Ottawa pour protéger le français.
Puis de vos collègues pour y arriver?
Bien, écoutez, là, c'est un dossier là, de négociation bilatérale.
We have More question? Go ahead, Mary.
I just wouldn't mind adding a bit on to that from BC's perspective and as well other provinces when it comes to immigration, when it comes to establishing a stable workforce going forward. We had 100,000 people come to British Columbia last year from across the country and internationally. A record number, unprecedented going back some 30 years. And that's exciting news for our economy, but it's also challenging. It brings forward the requirements for more housing, more healthcare providers, more spaces in our K-12 system, and a range of other costs. But you can build that through when your economy continues to grow, as it has been growing in British Columbia. But François and I have talked quite a bit about the Quebec's approach to immigration, working with the federal government, and we have the same outcomes in mind, but different approaches to it. And I think this is another example of how we benefit greatly by coming together and looking at how issues are addressed and developed in bilateral ways and in multilateral ways. And I believe that the Federation is working at its best when we have the opportunity to engage, to challenge each other on what's the best way forward, and then after a vigorous discussion, come out with a plan that meets the needs of all Canadians. That's how this country has managed to keep stumbling along over 160 some years, and I'm confident it can keep doing that, but we have to address the fundamental issues that matter to Canadians, and there's nothing more important to our citizenship than our public health care system. It separates us from the United States, thank goodness for that. And I know all Canadians will be more comfortable knowing that our orders of government are sitting down together to find a way forward. That's the minimum they expect of us, and that's we should at least do our very best to meet that bar.
Mary?
Mary Brook, Island Social Trends. This idea of the federal government being interested in issuing some more healthcare funds, but with strings attached, conditions. Was there any discussion today so far among the premiers that there would be any front-end preparation in the provinces? What I mean by that is, for instance, how BC prepared a good infrastructure for mental health and addictions, and then the federal government was interested in decriminalizing small amounts of drugs related to that. So it showed initiative. So I'm just wondering if that's going to be the back and forth in the negotiations.
Well, with respect to decriminalization, it was at the request of British Columbia that the federal government acted, but it took a long time. It took longer than we anticipated, but we got the result we believe we need for harm reduction, and there's multifaceted approaches to reducing fatalities from opioid overdoses, and we're going to continue working with all orders of government, municipal, federal, to do what we can to help people when they're at their most vulnerable. But again, we have been trying to get a dialogue about the path to a table, not negotiating quantums, not negotiating whether it's long-term care is the #1 priority, is it primary care. Every province has challenges, and our job is to deliver the services. That's the jurisdictional divide between our two governments. The provinces deliver the services. The federal government, in practice, and in principle, going back to the beginning, was to share in the funding of those services. And when Canadians hear us having a debate about accounting, which, and again, I apologize for my intemperate approach to the first question, but good Lord, people expect us to sit down and figure out how they're going to be able to get their hip replacement when they need it. There's going to be a long-term care facility for their parents when they need it. That the pharmaceutical advances that we're seeing are there to be provided to people, not at exorbitant costs, but at reasonable costs. That's the foundation of delivering public health care. And so when I get questions about, well, what's your #1 priority? Well, our priority is to table our budgets every year, as we do, and to try and put in place enough resources to meet the needs of the community. We have been coming up short across the country for a long, long time because we can't count on a stable partner. Full marks to the federal government for their one-time pots of money, but that only creates more expectations. It doesn't create a long-term plan. We need sustainable, predictable funding from Ottawa so we can build out our budgets, make commitments to healthcare professionals about how we're going to meet their needs, and most importantly, how we're going to service the patients that expect nothing less than our best effort.
That's all the time we have today. I'm sorry. Premiers will be back up again tomorrow morning at 9 a.m.